Everyone. Let me wait for some of you guys to join the live. So today, I am going to discuss buccal fat removal and chin lipo, my own personal experience, what I know about it, um, my advice to you guys about chin lipo and buccal fat removal, maybe dispelling some of the rumors that people like to say in the surgery community about don't do it, don't do this, whatever. So anywho, so this is me. I think I lost count. Hi Cabral, no waste. I think I'm 12 weeks, so 3 months post-op. Some of you guys want to see. So this is me, and I have not been consistent with my faja. I will be the first to admit I am terrible with that. So let's get into the questions that you guys had about the buccal fat and chin lipo. So I'm going to read off the questions that you guys sent me when I ask in my IG stories, what questions you have. So the first one is, I asked, what do you want to know about chin lipo? The first question I got, let's see, how do you keep the skin tight after chin lipo? So I don't want to say that there's particular things that you can do that will definitely make the skin get tighter. I mean, everything when you get lipo on your body post-op, there's different things that you have to do after surgery to make sure that you get the best for your money, right? So like any lipo area, after lipo, if you are older like I am, because I'm in my 40s, when you're in your 20s, you have really nice, good plump skin, hydrated skin, perky skin. So for us who may not have skin that retracts really well after lipo, because that's what it is your skin gonna retract or not, you may have to do radiofrequency treatments. So radiofrequency treatments to tighten up any lipo area, not just chin lipo, your torso, your back, your arms, your thighs, your inner thighs. And this is not only if you have lipo, you can do radiofrequency without having plastic surgery, without having lipo. That red light, what it does is increases collagen production in the body. And by increasing the collagen production, that makes the skin tighten up some. So how do you keep the skin tight after chin lipo? Radiofrequency. You also remember, guys, like any lipo area, you have to have compression. So that chin strap that they tell you to wear, you need to put that on 24/7, seriously, for the first 30 days at least, like for the best results. Of course, people say that, they have to go to work or they have to drop their kids to school and they don't want to wear it and whatever. I mean, that's life. That's understandable. So if you cannot wear your chin strap 24/7, you need to at least try and wear it when you're not in a situation where you're embarrassed or you don't want people asking questions. Another thing that I do when you have chin lipo is with the chin strap to make that area under here more tight so you can get that compression. I'm looking at Lola, she's on the floor. She's on the tile on the floor, I guess she's feeling hot. Laying down, and then there's a cat now walking outside and she jumped up to go chase his ass. You guys probably hearing there's two cats out there making noise. Anywho, so put a poisey pad. Put a poisey pad inside your chin strap, and that makes the area tighter. But it's not gonna be like something hard or rough that you're putting, inside the chin strap. It's a poisey pad, so that is gonna be like a soft but tight compression that you're gonna be getting. So next question, can I only go to get chin lipo, nothing else? Yes. You don't have to come to DR to get the full works. If you want to get little things done, I had one of my customers that was here last year for a tummy tuck. She came back twice so far. She came back to see the dentist, Dr. Laurie, to, I believe, finish her veneers. And she came back and she saw, what's his name? Now I forgot his name, but he's known for doing the PDO threads on your face. So she came back to do the threads on her face. So yes, you can come and just do chin lipo, buccal fat removal if you want, but you have to find a doctor that does it and pay whatever price that they're asking. A lot of doctors will do the buccal fat and chin lipo if that's all you want without, having surgery with them, major surgery, in office. So my experience was after I had my tummy tuck a week post-op, my plastic surgeon told me, we're going to do it in the office. I'm not going to do it while I'm doing surgery on you. So 1 week later, post tummy tuck, here I was in his office chair sitting totally wide awake, and I'm asking him, are you not giving me the blue pill to fall asleep? And he's like, no. You're not getting the blue pill to fall asleep. You are going to be totally awake. So I was wide awake. He gave me local anesthesia, of course, with the needle, to numb your face, numb the areas and so forth. But totally coherent, talking, everything. That was so nerve-wracking, having somebody cut into your face and do all of that good stuff without being sedated to some degree, and being very, very aware of what's going on and hearing when your skin is being ripped off your face while they're doing the chin lipo. That's the reality of it, guys. How long till you saw final results? I am 8 weeks post-op. So usually when you get chin lipo, it takes about 90 days. 90 days for that swelling to go down. I don't know what it is in plastic surgery, honestly, guys. And it's not just chin lipo and buccal fat. It's plastic surgery in general. When you are 90 days post-op, there is like some magic that happens with your body. I experienced it myself. I mean, the majority of the swelling is gone, so you start seeing your results popping more. Your butt, hey, Juliana, your butt starts fluffing more. Something about 90 days post-op is a magic number where we see a lot of our results like really starting to show out then. So for her question is, how long till you saw the final results? I would say 90 days post-op is when I really saw my cheek just got right here slimmer. All the swelling on the hair was gone, so that's my answer, 90 days. Did you get loose skin after? Is it worth it? I think it's worth it. You guys saw the picture. It's on my feed. You can go and take a look. That was 2017 with me driving the truck. And then that picture, when I posted it, was literally today. Like yesterday, I think I posted that, or the day before. So this is how I look now. And that's how I looked then. So for me, it was definitely worth getting the chin lipo. And I mean, maybe it's vanity on my behalf. But for me, a lot of it doesn't make sense for me to come and get a tummy tuck and then other parts of my body is looking, disproportionate. So that's why when I had my tummy tuck, I know my waist is going to be looking smaller, my hips rounder, my butt, more nice or whatever. I wanted to get my face done because I didn't want to have a fat neck, a fat face, and a skinny waist. So for me, that was my reasons for getting the facial surgery when I had my tummy tuck done. So yeah, I didn't have loose skin. Thank God my skin retracts pretty well, because you guys are always asking me about if I had a back lift, and I've never had a back lift. And my before, you guys can see how many rolls I had in my back. So for me, I did not have loose skin, and you guys can see here. It retracted really well. But those radio frequency treatments, not only is it for the body, you can also do it on your face. So there's a lot of doctors down here that do that. Of course, it's not going to be one treatment. You come down here and you do one treatment and everything is kosher. This is something that you probably would have to have like maybe 6, 8, 10, 12 sessions, depending on how flaccid your skin is. So a lot of places, I'm sure where you guys live, you just have to Google it and see who does radio frequency, who does cavitation treatments. And this is what you would need to get that skin to tighten up. Any little areas that you may have, little pockets of fat, because I mean, lipo could never be perfect. Lipo will never be 100. There's always going to be little areas when you do lipo that's going to be a little chunk of something left back. So if you do cavitation, that treatment helps melt that fat, and then the radio frequency now will help your skin tighten up. So a lot of you guys that are always very impatient, where's my results, like, you have to wait. My skin in my back didn't fully retract until over a year, post-op. It did not happen in 3 weeks, 6 months, whatever. Like, I had somebody message me the other day and said, I had a tummy tuck in July and it's not even a month post-op, and why is my belly still swelling? I mean, To me, that's a stupid question. But again, no question is stupid, right? So that tells me that this person have no idea what they got themselves into, that they had no idea what to expect post-op. They probably did no research in regards to what could possibly happen to their body after surgery. That you're not even a month post-op and you're asking me, why is your belly still swelling? So one question about chin lipo is, how long is recovery? I would say the majority of the swelling goes down probably about 7 weeks post-op. But for all your swelling to be gone and for your face to be back to normal and things like that, I feel like with any lipo, it's about 6 months, for everything to be almost back to normal. Hey, Sarah. All right. So the next one is, what do you want to know about buccal fat removal? So question number 1, what is it exactly? So people don't know what buccal fat removal is. Guys, it is so simple to Google. We have smartphones. Come on. I have 3 cell phones. Use Google. Just Google what is buccal fat. Buccal fat is the fat that's here inside your cheek. So when they do buccal fat removal, they're going to open up your mouth and they're going to pull your cheek or your mouth apart. And the doctor is going to go in there with a scalpel and cut inside of your cheek open like this. Let me see if I still have my scar. Very lightly. I still have a very light scar inside my cheek. But he's going to make an incision like that and literally cut out that yellow fat, that fat that's inside your cheek, and throw it away and then stitch the inside. So what it does is it makes you have like a slimmer looking face. So it kind of gives you that cheek contour look. So let me suck in my cheek so you guys can see it. Right there. So that's where they take the buccal fat removal or buccal fat out from. How painful is the recovery? It wasn't painful for me. You can't eat for the first couple of days. You can't chew because the inside of your mouth is very swollen. So I was drinking like smoothies, juice, like sipping on soup, but I was not like really chewing, like solid food. So that was probably for like the first 3 days. Also, to brush my teeth, to brush the back, it hurt. So I was brushing the front and, using Listerine to gargle. And then also you want to use Listerine because you want to make sure your mouth is as germ-free as possible a couple times for the day, because that's an area that they just cut open, right? You don't want to get an infection inside your mouth. So for me, the recovery was not painful. It was just uncomfortable with the swelling for the first couple of days. Does the fat ever go back to these areas? Yes. If you get fat again, if you gain a lot of weight, yes, it will go back to wherever you have existing fat cells. Guys, remember that our fat cells shrink and expand depending on if we gain or lose weight. So it's not necessarily that we're losing fat cells, that they're dying. The fat cells are shrinking as we lose weight, and they are growing or increasing in size. So let's say your fat cell is the size of a dime and you gain 40 pounds. Then it becomes the size of a dollar coin, right? So you have to be very careful depending on the look that you want after surgery. If you come down here just for lipo only, then you want to make sure when you go back home that you're eating super healthy, because you don't want to gain weight. The point of your visit was just for lipo only. But if you come down here and you have BBL and fat transfer, then it's a very thin line you have to walk, which is how much do you need to eat? When do you have to stop eating? How much of your BBL or your fat transfer is going to be lost, right? And how much of it is going to plump back up? And again, that's what I just said about your fat cells. Not necessarily that they're dying or you're gaining more. It's because they are shrinking or expanding depending on if you gain or lose weight. Does it hurt? How do you eat? How long is recovery? Yes, he just cut into your mouth. They just cut out part of your body. Yes, it's gonna hurt. How do you eat? Well, I just said what I did, right? For the first couple of days, I was mostly doing liquids and sipping on stuff. And the recovery, I said earlier, for me, I think the final results is probably 6 months, but the majority of your swelling is going to be down by 6 to 7 weeks. How much is it, and does it really contour? Let's see what she says. Does it really contour your face? Some doctors charge like $600 to do buccal fat removal. 500-600 to do chin lipo, but that's usually when you're having a major surgery. So I know one lady, she went to, and I'm not gonna say which doctor it is she went to down here, and did just chin lipo, and she paid like $2,000. That's what the woman charged her. That's what the female doctor charged her. And then she called me and was video chatting with me and showing me her results, and it wasn't even like nice, smooth, even lipo. Like her face healed crazy looking, because like some areas were lipoed more than the other areas, and this was just chin lipo. So it depends on the doctor that you want to go to get this procedure done. The more popular doctors, of course, they're going to charge you $1,000, or they're going to charge you $1,500, things like that. So if you are having major surgery, then you want to talk to your doctor about adding this as an add-on. That was it. That was the questions. That was the questions for lipo, chin lipo, and buccal fat removal. It's gonna rain here. Nice weather. Anyway, guys, so if you have any questions about the chin lipo, buccal fat removal, it is on my feed on Surgery Bay. You can go on, put a question there, and I will answer it for you. But this was the IG stories where you guys were asking about it. So my personal experience with it, and I'll go over it one more time for the people that just joined, is I had it done 1 week post-op my tummy tuck in my doctor's office. I was wide awake. I got local anesthesia. He injected me with a needle. Juliana says, I want chin lipo, but I had too much work done, but next time for sure. See, look at you coming back for your round 2. Yes, next time for sure. I mean, I still have some little things I want to do one more round, but I don't know. After I had this spinal fluid leak complication, this surgery, and I've never had a complication in any of my surgeries, that kind of made me feel like, do I really want to do this again? And then possibly something else go around, you know. Hey, mama, come. Lola's out here chilling with me. So, yeah. So, I had it done 1 week post-op tummy tuck. He did local anesthesia. The whole procedure, both procedures, I should say, it took maybe an hour. The first thing he did was the buccal fat removal. Hey, Nat. And he injected inside my mouth with the syringe of the local anesthesia to numb it. While he was doing it, you know, of course, your face feels heavy and then that numb, crazy feeling. And I really wasn't feeling any pain, but coming to the end of the surgery, I started feeling a little pain. So he had to inject me with some more local anesthesia. Then the chin lipo part. So the chin lipo part, he made incisions under each ear, here, and then one under here. The cannula is like super skinny, super small, to do the chin lipo. Injected me with the local anesthesia, injected the saline, which the saline helps to break down the fat, that makes it easier for them to lipo it out. However, the chin lipo part, I did feel some pain as the cannula was like going up into my face here, and probably down here as it was coming down here. But the craziest part about chin lipo for me was literally hearing, as he's sticking the cannula here and doing that and so forth, hearing your skin being ripped off your face. That was for me the craziest damn part of the chin lipo. Like, I was so super nervous, so anxious. My anxiety was on a whole nother level, because I really thought that he was going to put me to sleep for these facial procedures. And I'm not sure if I have those videos up on Surgery Bay. I know I had it at one point. I probably removed them. And I'm not sure if it's on my YouTube either. So I need to probably go on my hard drive and look for these videos and repost it so you guys can see the actual surgery. My nurse was recording it for me while he was doing it. So, and my round 3 surgery, I need to upload some of it for you guys to see. And then this video, I'm going to upload it to YouTube when we're done here. So if you guys missed the beginning of the video talking about buccal fat removal and chin lipo, it will be on YouTube. I am trying to be more active on YouTube again. But please send me suggestions of topics that you guys want me to talk about and discuss, give my experience on it, because that's what it is, guys. Surgery Bay, the platform is about me giving my experience. I don't want to say that what I did is right and what I did is wrong. However, everybody have their own way of doing things, and I can only tell you what worked for me. It's up to you if you want to do it or you don't want to do it, right? So anyway, I am going to end the live, and I will talk to you guys later. Bye.